Welcome to PSY 318, Study Session 6, Eating and Habit Disorder. Introduction. Disorders whose primary symptom involve a disruption in individual's pattern of eating, elimination, movement, or communication will be discussed in this lecture. The eating disorders can occur at either extreme, excessive consumption of food or dramatic reduction in food intake. Both have life-threatening consequences. The habit disorders of elimination, movement, and communication, acquiring socially appropriate habits with respect to this behavior is of critical importance for healthy development. Problems with elimination, referred to as enuresis and encopresis, can have significant psychological causes and consequences. Similarly, the ability to communicate clearly and maintain conscious control over movement is central to the child's functioning in society. In this lecture, we will also discuss stuttering and tic disorders. Objectives. At the end of the lecture, you should be able to 1. Identify the eating and habit disorders, 2. List the eating and habit disorders, and 3. Mention or list the symptoms of eating and habit disorders. Pre-test. 1. List the 2 major categories of eating and habit disorders. 2. Mention the symptoms of anorexia and bulimia. 3. Mention the prevalence of anorexia and bulimia. Content. Eating disorders, anorexia and bulimia. The 2 major categories of eating disorders that we have are anorexia nervosa and bulimia. These 2 disorders have distinct features, but they also share some common symptoms and common etiologies. They show a similar developmental course. They tend to begin in adolescence, but do not extend past early adulthood. Anorexia nervosa. People suffering from anorexia nervosa have an intense fear of gaining weight despite being much underweight. Even when they are emaciated, people with anorexia often feel fat. There are 2 subtypes of those with anorexia: restrictors and purgers. Restrictors are thin primarily because they refuse to eat. Purgers also refuse to eat much of the time, but when they do eat, they use vomiting and laxatives to purge what they have eaten. The consequences of anorexia can be severe, such as having low blood pressure and low body temperature. The occurrence of life-threatening cardiac rhythm has retarded bone growth and anemia. Moreover, the low level of serum potassium caused by starvation can lead to irregularities in heart rate that may cause death. Amenorrhea, the absence of menstrual periods, is common among girls or women with anorexia. About 95% of those with anorexia are female. The prevalence of this disorder appears to be rising such that about 1 in 100 females suffer from it. Anorexia is considered a disorder of childhood because its onset is usually in early to late adolescence, although it can begin at any age. Psychosocial theories of anorexia suggest that it arises from the deep need for autonomy, which comes from being in over-controlling family. Anorexia can be a difficult disorder to treat. Clinicians and researchers explore the use of psychotherapy in treatment, while more recent approaches rely heavily on behavioral and cognitive therapy techniques to help the families reduce the symptoms. Bulimia. Binging on food is not uncommon, but people with bulimia are excessively critical about their binges and more generally about their physical appearance. As a result, they attempt to purge after a binge by self-induced vomiting, by misusing laxatives, diuretics, or other medications, by fasting, or by excessive exercising. Often, the binge or purge episodes take hours out of each deny and become habitual. Many sufferers of bulimia also suffer from severe depression. Majority of people who suffer from bulimia are women. The women also experience menstrual problems. Frequent vomiting and other types of purging can also lead to severe loss of fluids and an imbalance in electrolytes, which regulates the heart. Such an imbalance can result in heart failure. Some researchers believe that both anorexia and bulimia are variants of a mood disorder. In recent years, there is an increase in the prevalence of both anorexia and bulimia, and they are common in developed countries than in underdeveloped countries. Cultural norms play a role in the etiology of these disorders. Thinness is considered a virtue in some societies, especially for females. The ideal shape for women, as indicated by television stars, fashion models, and winners of beauty pageants, has been that of a thin frame. Some women succumb to this pressure by going on extreme restrictive diet. Many women who develop bulimia have a history of going on extreme restrictive diets, which are chronically stressful and frustrating. Other times, purging is a way of reducing the stress that binge has caused. Summary. The two major categories of eating disorders that we have are anorexia nervosa and bulimia. People suffering from anorexia nervosa have an intense fear of DASH. The two subtypes of anorexia nervosa are restrictors and purgers. About 95% of those with anorexia are female. People with bulimia are excessively critical about their binges and more generally about their physical appearance. Many sufferers of bulimia also suffer from severe depression. The term enuresis is defined as involuntary urination at least twice a month for those who are older. Stuttering is a marked disorder in speech rhythm. The signs are first apparent by the time the child is 3 years old. The tic is a repetitive involuntary movement or vocalization that has a very sudden onset. Post-test. 1. Mention the two major categories of eating disorders. 2. People suffering from anorexia nervosa have an intense fear of DASH. 3. The two subtypes of anorexia nervosa are DASH and DASH. 4. DASH is common among girls or women with anorexia. 5. DASH % of those with anorexia are women. 6. People with bulimia shows DASH about their binges and DASH. 7. Many sufferers of bulimia also suffer from severe DASH. 8. Another term for enuresis is DASH. 9. Primary enuresis occurs when DASH. 10. Factors play a role in stuttering. End of study session 6. Thank you for listening.